Welcome back. Tech Zone, Paul Amadeus Lane. So happy to have you back with me. Second segment of the show. If you missed our first segment, you can always check it out. Podcast, YouTube, you name it, we got you covered. You know, on the show, we always talk about how technology has changed the game when it has come to business. If you are a business out there and if you are not embracing technology, you may be left behind. But we also like to talk about the entrepreneurial spirit out there that ones have. Have you ever had an idea and you wanted to expand on an idea to create a company, but then only to have it fall by the wayside because maybe you've gotten criticism from others saying, don't do that. There's no market for that. How do you know if you don't take a chance if it's going to work or not? My next guest took a chance on business and a company, along with some partners, has also embraced technology in order to stay relevant, and is now expanding tech jobs here in California in Temecula. It's been 30 years. You think he's glad he took that chance and took that journey? Oh, and should I say also, the company is profitable? That's why I'm so happy to have joined me right now. And joining me right now, I have the chairman, CEO, co-founder of American Specialty Health, Inc., George DeVries. George, how are you, my friend?
Doing well, Paul. Thanks for having me aboard this morning.
It's my pleasure, my friend. And when I was looking at your company and just the journey that you guys have been on, it has been truly amazing. And I wanted to start the discussion about how the company started. And I heard a rumor that it started off in a 2-bedroom condo. Is that true?
That is true. It was my wife and I 30 years ago, and she was working to support us, and I was working out of the second bedroom of the townhouse we lived in.
Wow, it's awesome to have a supportive wife to allow us to do our thing and be supportive, and it is truly amazing. And looking at the journey of when you first started out, did you ever think that you would see the growth that you see today with the company?
Well, you know, Paul, you always kind of hope and dream, but realistically, you think, well, I just need to sort of take care of first things first, and we just want to try to get these things off the ground, and that's what we were really focused on back then. But it's hard to believe the journey we've been on for 30 years and where we are at today and the prospects we have for the future.
And when you created the company, was it something that you saw a need for out there and said, you know, it would be nice to have a company that can focus on this area right here? Or was it something that someone else brought to you and you said, you know what, let's put this together?
Well, I had two partners out of Minnesota, and they were focused on trying to build what we call a network program of chiropractors that we would take to health plans and encourage the health plans to offer chiropractic utilizing our network of providers, and we would administer the program for the health plan. So that's kind of how it started, and they were trying to get it started in Minnesota, and so the three of us got together and said, you know, let's try to see what we can do in California.
You know, I'm glad you brought that up because over 30 years ago, a lot of health plans wouldn't cover chiropractic care, correct? Ones had to come out of pocket and pay for it, correct?
That's absolutely correct, Paul. In fact, in California, originally health plans, HMOs, did not offer chiropractic, wasn't required to offer it. So we'd go to the health plans and we'd say, offer a chiropractic benefit and we'll organize it for you, we'll administer it for you, and then offer it to employer groups, the employer groups that you're providing medical coverage for, and sell it to those employers like you would a vision or dental plan. So it became what we call a supplemental group rider that that an employer would purchase for their employees. So that's exactly the way we started.
And as you go through the journey now with the new company, talk about the importance of having a supportive team over the years to really continue on with the vision that you had when you first created the company.
Well, Paul, I think most people really understand people make all the difference. And the people you have on your team really make the difference between being a startup and ultimately getting to where we are today, which is a $500 million a year company in terms of revenue with terrific prospects for the future. And I think the thing, as I look back in the last 30 years, the thing I'm most grateful for is just really great people, key people have come along at different times, joined our team, whether it be from human resources or operations or sales and marketing, technology, information systems, that people have joined our team and really helped us to build the company that we are today.
That's amazing, because I always say that, make sure I say it correct. Teamwork makes the dream work. I said it right that time. So yeah, got to have a supportive team, out there, and just the success that you guys are achieving is truly admirable. And let's talk about, I guess, some of the challenges along the way when it came to the company and also the industry. Were there things along the way that may have threatened what you guys have put in place?
Well, this is America, and it's a dynamic economy. It's a competitive economy out there. I don't think it matters what industry you're in. It's always challenging. And sure, lots of challenges along the way. That's part of what's made it sort of a great ride, I guess I would say. And we've made a lot of decisions at Y's in the road that I think have turned out to be very good business decisions that really made the difference between us perhaps sputtering or not becoming the company, at the very least, not becoming the company we've become.
And when it comes to being the chairman, CEO, and also co-founder, being the captain of the ship, there are times when you have to reassess certain things to make sure that the company is staying relevant, that innovative ideas are out there, and staying relevant through the decades. How have you guys been able to do that when it comes to innovation and when it comes to just the company's vision?
Well, that's the real challenge for every company. How do you over a period of 30 years stay creative and innovative? And I like to think we are a very innovative organization, that we're a learning organization. And I say that in the context that even though I'm chairman and CEO, we have a very flat organization. I stay very close to our customers, involved with our sales process in terms of really being in the market and meeting with customers, talking with customers, understanding where they're at, what they need, what their vision for their future is, how we can help them grow their organizations, how we can be a solution for the things that they need. I think also it's looking beyond our industry. It's looking beyond our company and looking more wholly at, what other industries are doing. I mean, when you look at some of the things happening in the world of technology, when you look at some of the things happening in other industries, I think they set some pretty good examples of things that we can be doing in healthcare that perhaps we're behind on.
And you know what? I've been covering the consumer technology field for over a decade. And I remember at the Consumer Technology Association show they put on CES about 5 or 6 years ago, I was talking with the marketing guru over there, Steve Koenig, and we were talking about the Internet of Things. And we were at a conference by Sean Dubervac, and we were talking about digitizing things. Should we digitize that? Should we digitize that? And how in less than a decade, we were going to see how different technologies out there are going to start integrating some of these technologies in order to stay relevant and also to continue on with the mission. And how has technology played a part in your company now? Because just recently, you guys are really like pushing this tech and to really help out with the company and helping out the consumers out there.
Well, technology really has been a key focus for us for 30 years. When we started our company, there's no off-the-shelf software system that could help us to manage chiropractic claims, so to speak. And so we built our own integrated health information system. And Paul, it's one of those blessings in disguise. The At the time, it was very difficult, expensive, but in the end, we look back on it, it's probably one of the best things that ever happened to us because, at that time, having what I would call a mission critical application, which at that point was our health information system, allowed us to be more flexible. It allowed us to work with our clients in a more flexible environment. And we ultimately ended up over the first decade of the company contracting with most of the 10 largest health plans in the state. But even back then, in the late 80s and 90s, technology played a key part for us. And then as we advanced and went forward, we again used technology as we built a website that for the providers we work with to be able to go online to do anything that they would do with us by paper or by phone, they could do online. And that's become probably one of the instrumental things that has helped us to improve our efficiency and effectiveness. As we've moved beyond that over even the last decade, we have, especially in the last 5 years, Paul, we've actually split our technology team into two. And one is our information systems team that really focuses on our infrastructure. And the second is a consumer technology team that's really focused on what you would say are the consumer applications, whether they be, digital platforms that consumers can use to help improve their own healthcare, whether they be member apps, that people can use mobile apps and access information more quickly, whether it's what we call connected, which is connecting our members to the hundreds of wireless devices for fitness and different types of health devices. So it is an amazing sort of road we've been on, but we've really seen ourselves as an organization really become a technology-enabled healthcare company. That technology is really driving our opportunities to be more efficient, to be more effective, and to be more focused on the consumer going forward, which I believe is critical for success in healthcare.
Absolutely. Absolutely. The way things are going. I mean, everybody has a smart device, and they have smart watches. They have all these different devices that are digitized, and why not use them for good? There are some nefarious things that people do with these devices. Use them for good, use them for health, and what your company is doing out there, I think it's spot on. And when it comes to the different technologies that you guys have implemented, how do you guys decide which technology to implicate and maybe to put on the back burner for a little while? How do you guys come up with that decision?
Well, that's always a tough one. That's always the one of choosing priorities and kind of looking at our vision as a company and sort of saying, where's the best opportunity for us as an organization in the healthcare industry, and what are the things we can be doing to really, kind of goes back to the purpose of the company, which is to improve quality of care and to bend the cost curve, help make healthcare more affordable. That's the purpose of our organization with everything we do. So as we look at, kind of choices we make and priorities we set, it's in the context of that purpose and sort of saying, okay, how can we really use technology in a way that makes us more efficient and bends the cost curve, reduces the cost of healthcare, and also improves clinical quality of care. And that's a lot of things fall by the wayside with that, when you look at it in that context.
That is so true. And I just want to let the audience know some of the things that you guys have achieved over the years. I'm gonna gloss you guys for a minute. George, over 42 million members covered, 60,000 clinical providers working with American Specialty Health. Silver and Fit program celebrates 10 years with over 3.8 million members. Introduced the Empowered Decisions pain control program for back and other musculoskeletal conditions, and introduced Active and Fit Direct self-pay customer fitness and exercise program. You've been holding out on me, George. You guys have been awesome, and I'm just hearing about you guys.
Well, we've, never hurts, Paul, to fly a little bit under the radar, and we've been been working hard through the years. I mean, we do work with about 140 plus health plans across the country, and we're in all 50 states, and we do serve 43 million Americans through those different programs. So our name isn't always at the top of the marquee, so to speak, but I think everybody knows the health plans we work with, and in many cases, the large Fortune 1000 companies who we have the opportunity to work directly with. So and we have a lot going on. Innovation as I've said before, but Paul, innovation is kind of critical to our organization. We have a whole innovation teams for each of our key business areas that meet every quarter. We're constantly sort of saying, how can we enhance and improve what we already have, and how can we take products we have, create, sort of look at adjacent areas to those products, and build sort of new creative products and bring those to market. And I think that's what we've been really focused on. So we've ended up over the past 30 years later with 2 to 3 dozen products that we have in the market that have really worked for us and are continuing to work for us.
And you guys are growing too, because you guys are expanding to Temecula and bringing tech to Temecula. And let's talk about that growth.
Yes. Well, we have over 200 full-time technology staff already inside of our company. And we have a company of about 1,400 full-time employees across the country. And but technology is a key part of how we know we're going to be successful going forward in the future. And so we're looking for ways to continue to attract and retain just some of the best talent in technology. And yes, we have a large technology team down in San Diego at our offices in the Sereno Valley area. But we want to continue to expand that technology team, and we're not, shall we say, bashful about opening a new office somewhere where we think, we can build a core of people that can really help us kind of continue to build the company. And so we've identified Temecula as what we think would be a great area for a dedicated technology office where we can have, upwards of 50 full-time technology staff that can be working in conjunction with the rest of our technology teams across the country, but working with us on in the inception and design and development and bringing to market of new technology capabilities.
Well, thank you for bringing tech here to the Riverside County. I've been in Silicon Valley, I've been in other tech hubs, and it's nice to have ones in California. So maybe we can make this the new Silicon Valley out here, and your company was at the forefront of doing it, George. And I think it's amazing what you guys are doing. Thanks for bringing jobs, here in California. I tell you, it's awesome. And I don't want to forget to let the audience know out there what your slogan is. And the slogan is to empower individuals to live healthier and longer. And you guys are definitely staying true to that vision, George.
Well, thank you, Paul. It's been a pleasure.
And thank you. And we'd love to have you back on again, and we'll see how things are going later on in the year, okay?
Sounds terrific, Paul. Thank you.
George, it's been a pleasure talking to you. Folks, that was George DeVries, Chairman, CEO, co-founder of American Specialty Health. Enjoyed my conversation with him. I really did. Now, I want to give you some information out there on the website. Now, he talked about jobs coming to Temecula if you're looking to relocate or maybe you live in an area. Now, here's their website right here. You can go to www.ashcompanies, it's plural.com, ashcompanies.com. And there you see a tab for careers, and you can click on there and you can check out the careers that they have there. It looked like a really cool company to work for. Should I retire from my media gig and get into tech? I don't know. What do you think, Sean? Should I do that? And also, they have a pretty cool YouTube too. I want to play that for you too. It's really quick, but you can definitely check out the intent behind it. Here we go, right here. YouTube talking about the new center they opened up, tech-mecula.com. You can go there too as well. All right. Well, when we get back, we're going to talk about, remember in the 80s when the song came out, how, what was it, Video Killed the Radio Star? Well, how's mobile killed the shopping cart? We're going to find out the answer to that question coming up as my next guest join me on the show. Don't go nowhere. We'll be right back on the Tech Zone.